brought to you by Alps Hospital and Diagnostics. And oh yes, I'm so excited to be your host again on the show, and my name is Esther Benjamin. So on behalf of all of us here at Alps Hospital and Diagnostics, we want to say a very big thank you to you all our dear viewers for following, liking and sharing our page at Alps Hospital and Diagnostics. Thank you very much. So we brought to you another very insightful segment of the show again, where we'll be talking about something very interesting. This is the point where you have to share if you've not shared and then stay glued to your screen. We're talking about assisted reproductive technology and multiple pregnancies. And to join us for this very insightful conversation is none other than the exceptional Dr. Kenneth Egwuda. Dr. Ken is here with us and he looks amazing this afternoon. Good afternoon, sir.
Getting ready for the weekend.
Oh,
Nice to be
right.
here,
You look
man.
really, really good, sir.
Thank you. You look good too.
Okay, thank you very much, sir. For those of you who do not know, you're probably joining us for the very first time. It may interest you to know that Dr. Kenneth Egwuda is a consultant gynecologist, a minimal access surgeon, a reproductive biologist, and an IVF specialist. So much for the amazing Dr. Ken.
Thank
It's good
you.
to have you. You're such an honor, sir.
My pleasure.
Okay, so someone is watching right now, sir, and they're wondering, what is this thing about assisted reproductive technology, sir? So what is it? What can you say? What is assisted reproductive technology and who needs it?
Oh wow, thank you so much. Good to be on this platform with you again. Yeah, it's always fun talking about what you love, you know. And for me, assisted reproduction technology, it's just a passion, you know. Yeah, and then it just means a kind of reproduction where a couple is aided, you know, where either the eggs are manipulated or the sperms are manipulated or both are manipulated, and fertilization is meant to occur outside the human body,
Okay.
you know, and after a few days, the product of fertilization, in this case called embryos,
Okay.
transferred into the woman's uterus for pregnancy to have a chance to occur. So that's assisted reproduction technology. Fertilizing the eggs outside, you know, and transferring the product into the uterine cavity, and then watching for pregnancy to occur. In a nutshell, that's what assisted reproduction technology. That's the basic assisted reproduction technology. And the person that needs it, or a couple that needs them, or that needs assisted reproduction technology, are those that have challenges with spontaneous conception.
Okay.
You know, yes, when I mention spontaneous conception, I use the word to fight against the word artificial reproduction technology or artificial conception, because some people say they conceive naturally, and so that presupposes that there is another form of conception that is not natural, which is not true.
Okay.
You understand? So it's called spontaneous conception when a man sleeps with his wife
And achieve
and achieve pregnancy, you know. And then it's called assisted reproduction, where a couple needs some form of help, from small help to very big help to achieving pregnancy. So those who need them are a lot of reasons why people will need them. When a woman's fallopian tubes are bad,
Okay.
we call it blocked or diseased, so it cannot transmit egg into the uterine cavity for fertilization to happen. So they need assisted reproduction technology. When a man has a very low sperm count,
Okay.
and then they couldn't get to the point of hitting the eggs for fertilization to happen, they need assisted reproduction technology. So there are many reasons why a man's sperms can be bad. It could be disease condition, could be genetic, could be a blocked vas difference or something. Then they need assisted reproduction technology. A lot of women are out of eggs because of age, and the age at which they get out of eggs are different for different population or for different individuals. So when they're out of eggs, they need donor eggs. To get pregnant, they need assisted reproduction technology. Now, just yesterday, I had a discussion with few people, and they go saying that when they needed to come for an IVF, somebody told them, no, you don't need to go for an IVF, that you're very young.
Wow.
That you're too young to go for an IVF. I said, now I'm getting another story. Too young for IVF? Why? So the perspective or the notion of people around this environment, or in some regions, or maybe some regions of the world actually, feel that assisted reproduction technology is for the older people. You understand? So I go telling, a woman may be 19 years old with blocked fallopian tubes. So she can stay as long as she wants to stay, and she cannot get pregnant. She needs assisted reproduction technology at 19 years old. At 19 years of age, rather. A man can have no sperm, poor or low sperm, at any age. Married to a woman at any age, he needs it. So it's not an age factor. I think what swayed them to that part of thought is that, it's very expensive to do an IVF. And so women take time, or couples take time to gather money. And so when they have the money, they're already old. That's my thought, Okay. And so they feel it's just for the aged people. And some people struggle with accepting it while they are young, only to accept it when they are old. So you have a higher population of older people coming for an IVF. But I think the more the younger people see the need and accept the need for it and access the service early, the better it is for everybody, because pregnancy, the quality of eggs, qualities of babies are better when conception is done early in the female age. Yeah. Wow. So those are some few reasons. There are a lot of reasons why people need IVF. A lot of reasons. When gay couples get married, for instance, in fact, as they're thinking of getting married, they should have an IVF somewhere at the back of their mind, because conception cannot happen in that on biological, states. A man and a man getting pregnant, how? A woman and a woman getting pregnant, how? It's just not biologically matching. Yeah. So they need some form of assisted reproduction, to get pregnant. So a lot of reasons. And the most interesting reason now we're seeing is that when there are genetic mismatch, and babies are going to have some gene transfer for some diseases that are not compatible with life, or they don't allow you to achieve your maximum potential in life, you may need an IVF with genetic diagnosis so that the healthy embryos could be transferred to the baby. This is the kind of IVF that should be done when you have sickle cell mismatch, sickle cell ASAS couple or something. And more importantly, the future for IVF, when there is a disease that should be stopped. You do an IVF and do what we call a CRISPR. And then you do a gene, you send a CRISPR, a gene editing material into the embryos, and it goes to exactly the gene location where the abnormality is, cuts it off, and reattach a normal gene. That way, babies are born without abnormality. So I can mention a lot of reasons without stopping why IVF is necessary. Yeah, and the reason keeps expanding. Yes.
Amazing. Speaking about IVF, sir, I remember a friend of mine who had waited, and very young, beautiful lady was unable to achieve pregnancy, and so she opted in for IVF. Luckily for her, she was told, according to the story she told, that she had 8 beautiful embryos, and she requested that all these embryos be transferred back to her, and she wouldn't even mind to have a quadruplet or even have as much as 6 babies, because of course she has waited for long to have these babies, but then it was declined. Is there a problem with multiple pregnancies, sir?
Oh yeah, we see that scenario all the time. Women feel because they have waited for 20 years, for 10, 13 years, and so it's a time to have their wasted years recovered with one stone, Yes, and then you have them on the embryo transfer table, and the discussion of the number of embryos to be transferred, and they just go without thinking. Just put everything. Put everything.
Of course.
See, madam, hold on, man. This is not time to do that. Put in everything. Yeah, it's always going to be declined, because it's not a child's play to have multiple pregnancies. Multiple pregnancies have lots of problems associated with them.
But it seems to be celebrated in Africa, of course.
Oh yeah,
A woman who has triplets is giving better preferential treatment. Her mugo is different from someone who has just one child.
that's a situation where we say that ignorance is bliss. Multiple pregnancy has a lot of challenges, a lot of complications, and most times the mother's health is compromised. The baby's health may also be compromised, or the health of both the mothers and babies are compromised. Yes, only few actually escape this compromise, and they go on media to celebrate, and the world sees fourplets or quadruplets, triplets, and then they're celebrating. Okay, this is actually an accident of assisted reproduction technology.
Serious, sir?
Yes, because most times these multiple pregnancies are miscarried. But because people don't celebrate and don't talk about the miscarriage, you don't know what other women go through. If a woman have quadruplets, for instance, she's going to give birth before time, premature babies, and then the complications of prematurity you don't want to know. These babies may grow up with some debilitations later in life, because one, they may be born before time, and then the battle to survive, because to survive the extrauterine life, and then a good number of them in sub-Saharan Africa, for instance, may lose their lives. At the end you have just one surviving, or all not surviving at all. Then the cost of actually managing these premature babies, it takes a government to manage premature babies. Oh yeah, because it's very expensive caring for premature babies in the hospital. They need every attention, they need every detail, they need every care. And at the end of the day, they need breathing support. At the end of the day, they survive with some defects or with some challenges. So those are the truths that people don't talk about. Yes, and even we sometimes haven't seen somebody failed an IVF, and then you're tempted to want to put more than what is necessary just to achieve pregnancy at all costs. But that's also not good, because one, the health of the woman is very important. Then we just mentioned it, a good number of these women come for these services when they are advanced age. Then you want to put quadruplet, 4 embryos in a womb of somebody who is already advanced in age. Then she'll be exposed to medical conditions, diseases in pregnancy, hypertension, diabetes in pregnancy. Then she may also have miscarriage. And that's not all. We actually see a lot of morbidities and mortalities coming with multiple pregnancy. So I don't know how long we're going to tolerate that in this part of the world, because it is not anything to be tolerated. Those our counterparts in the European nations have passed through some of these challenges and have put laws and stipulated laws for the number of embryos that must be transferred.
I was going to ask about that. Are there guidelines to number of embryos to be transferred currently in Nigeria?
No, in Nigeria, we don't have a Nigerian guideline.
Okay.
But most practitioners of assisted reproduction in Nigeria are trained in the Western countries, and a good number of us belong with the European Society of Human Reproduction and Embryology and American Society of Reproductive Medicine. So we work with these guidelines. But then, since the law, the governing body is not seated in Nigeria, for instance, you could break the law without any consequence. You understand? So, but the guidelines are coming up gradually in Nigeria. I know that the bills is with the National Assembly to put regulations to assist reproduction technology. Then Lagos State has taken the lead. It has a lot of guidelines on what is permissible in assisted reproduction technology. And if you go out of the guideline, you may have to face a medical panel, a panel and all of that. So guidelines are coming. But what we know to be guidelines are that in Europe, for instance, you are not expected to transfer more than 2 embryos. Oh yeah, 2 is the maximum that you could transfer. The reason is that a woman's life shouldn't just be jeopardized because she wants to have kids at all costs. You see a woman carrying a triplet, for instance, sometimes she walks with her legs wide open. We call that a broad-based gait in medicine. Sometimes they have a splitting of their pubic bones because of the weight of the babies. And then when they're 30, 33 weeks, they can't even walk. They're bedridden. And then the body is so blown out of proportion, and then they never recover after delivery. Some never recover after delivery. And then you have 3 babies you're caring for. The problem of caring for just one baby is enormous, and let alone 3 babies. So in Europe, just 2. And in some European countries, only 1 embryo. You don't go beyond one embryo. Yeah, whatever happens should happen.
Wow.
Has to be 1.
Oh.
So I think it's an unnatural desire for success, irrespective of the health of the woman and the health of the baby, that makes people transfer multiple embryos. I'm not saying we've not done that, but we have put all of those things to check as I speak with you. So it's not just very. I was in one of the European countries, shadowing not too long, and then a woman got triplet, and then a body of inquiries was raised to come and answer why this woman had a triplet. And that's a place where the lives of women and babies are valued. Because you're exposing the woman to unnecessary risk, and you're also putting the baby's life to risk. And so it's a risk that shouldn't be accepted. So why people celebrate it, they celebrate because of ignorance. And that's why they say ignorance is bliss.
I'm also guilty of this.
They celebrate because of ignorance. So we practice assisted reproduction technology. We are happy when people get pregnant. But man, triplets. In fact, there is no gynecologist who is comfortable with a triplet. To be candid with you. Everything about triplet pregnancy is just not very great. The gynecologist is always waiting to hear whether there's a problem. Delivery is a problem. Caring for the babies is a problem. Antenatal period is a problem. When they deliver and the babies are growing, they look blissful. But then the woman and the babies have passed through a lot to get to that stage. And not many of them survive it. I really wonder what happens when I see on Facebook, for instance, quintuplet. What's quintuplet again? Quintuplet.
Is that supposed to be 8?
And sextuplets, and all of that. Octuplets. See all of those things, and they're just lining up the babies like...
something to be celebrated.
Oh, yeah. Nice. Just not nice. So please, multiple pregnancy is very risky. Not many women survive to tell their stories.
Oh.
So we are telling the stories of those who haven't survived.
These are really the untold stories.
These are the untold stories of multiple pregnancies. Forget about the celebrations. Anytime I see a multiple pregnancy, I just look at the woman as a hero. You just survive by the whiskers. Seriously? Yes, because man, it's tough.
Dear viewers, you agree with me that this is really eye-opening, like so insightful right now. I have never thought about it this way. We celebrate the quadruplets, the triplets, as though that's like one stone to kill 3 birds.
Oh, yeah.
Oh wow, that's amazing, sir. So, sir, what do you consider the ideal number of pregnancy? What is the ideal number?
It's 1.
Really?
Oh, sure, 1. One baby is hell already. Being pregnant with 1 is like, well, I'm not a woman.
Okay.
I usually watch them, sometimes they're moody, sometimes they look as if the world they are hopeless, sometimes they need extra care and all of that. They get to some point, they want to even cuss out their husband or their partners who make them pregnant. Just 1. Then you can imagine when it's 2 they're carrying. Then unthinkable when it is 3. So the best pregnancy anywhere in the world is 1 baby. At least the prospect of taking that to a logical end is high. Okay. Even there are medical complications in pregnancy which could happen with only 1 baby. It's easy to manage. You're not grossly afraid of premature delivery that comes from multiple pregnancy. There may be other reasons for premature delivery, even with a single baby, if there are problems with the mother or with the womb or with the baby itself. You know, the best is one. It's easy for everybody. It's easy for the family. It's easy for the woman. It's easy for the health. It's easy for the government. You know, it's easy for the government because in functional societies, for instance, the government cares for the health of the population. So you can imagine the government diverting the whole funds that should be cared for 4 more people onto one woman. And how much are you contributing to the society anyways? And that is why, well, it is more stringent, you know, and more offensive having multiple pregnancies when you are under an insurance in an European country.
Oh, wow.
You know, yeah, because you're straining the government. You're straining the insurance companies. You know, and then, so 1 is just the best. 2 is tolerable, but 3 is unthinkable. It shouldn't happen.
Wow.
It shouldn't happen. I'm not saying because I don't have patients who have triplets, you know, but God knows I may laugh openly and I'm scared to my bones, and at some point I want to run away.
Are you serious?
That's the candid feeling.
Oh.
Yes, that's my candid feeling. Because I know she's going through a lot.
Yeah.
You know, she's going through a lot. And anytime I see the calls, I just want to hope that she's not contracting before time.
Oh my God.
You know, so that's my feeling as a gynecologist and as a reproductive gynecologist. You understand? So, and then you hear that at 28 weeks she's admitted. I say, Jesus Christ, this pregnancy is about to end. 28 weeks. Then at 32 weeks, they are going to be delivered. Triplets, you know, the lungs are not matured yet. They're going to need some form of respiratory support. You know, they're going to have a lot of intervention in the hospital. A good number of them don't survive where there is no good health care. And then you want to put a woman in that situation. Women who don't have monies. You know, usually, yeah, we have them, but that's my feeling. And I'm sure a lot of other gynecologists feel the same way I'm feeling. I do not celebrate it. When I hear about that, I was like, okay, yeah, you guys are at it again. You guys are at it again. Let's hope. Let's keep hoping. Yes, and I don't want to talk about fetal reduction right now. That's a story for another day.
Wow, there's something like that. Oh, wow.
Maybe on that day I'll tell what my candid feeling is, and where my heart is, and what my stand is about fetal reduction. And the logic there for me is this. Why should you lose 4 babies where you can save 2? I don't want to explain myself, so don't ask.
This is really making me curious right now.
No, we're doing multiple pregnancies and the complications.
But we look forward to that conversation really about fetal reduction. I can just imagine how it would be. What you have stored in your head right now.
Yeah, that's one other thing.
Okay, but it's fine. But dear viewers, you agree with me that...
And of course, if you don't want to get to fetal reduction, don't do multiple embryo transfers. Yes, so you don't tempt guys like us who are very adventurous.
So you're saying that one embryo is okay?
Yeah,
even if
that's the
someone had
best.
to wait for 13 years.
Yes. Should you, because you've waited for 13 years, jeopardize your life? Yeah, that's the logic there. Even if there is no guideline. You're seeing a woman who is hypertensive and probably having a borderline sugar control, and you want to make her pregnant with 3 babies or 2 babies. That's like attempted. Is it attempted murder or attempted manslaughter? That's the way I see it.
Yeah.
You understand? Because at the end of the day, she loses her pregnancy and she gets incapacitated, and then you're happy. So I think at any point in time, our intervention shouldn't put the life of a woman in jeopardy. That's just the guideline. Yes, I know there are things to think about before embryo transfers.
Yeah.
The quality of the embryos. If they're low quality, you want to tempt you to do more than 1 or 2 embryo transfers. You know, and the age of the woman and all of that, and the health status of the woman at that point in time. Yes. Looking from African perspective, you've seen that they're coming to do IVF with from a low socioeconomic background. If they fail, how often can they afford to do another IVF? as against the European perspective, for instance, where the government fund the IVF for people and pay you stipends for accepting to be pregnant.
Are you serious?
I think some of us should be Europeans.
Really? Really,
Caucasians, Yes, they pay them stipends in some places, So they don't even care about the pain of losing a pregnancy and in failing an IVF treatment because somebody takes responsibility for that. That's the beauty of population. Maybe some other times look at our beauty of population. Yes, so because that's just what it takes. So, but then you put all of that in perspective. I know it's not as straightforward and as easy as I'm making it. There's a process we call decision making in medicine. You put everything in perspective. The funds, the financings, the funding of the treatment, the health of the woman, and the possible risks to the embryos you're transferring, should they become all pregnancy and become babies. Yeah, so, that's how good it gets. It's not that straightforward, but a woman shouldn't just lose her life because trying to get pregnant.
About this before now, but thanks to Dr. Ken, it's been an insightful segment so far. This is the much we can take today on the show, and we look forward to coming your way again next week. I remain your host, and my name is Esther Benjamin. Thank you so much.
Anytime.